Hello and welcome to the EduTalk series hosted by Biotone, Biotone EduPartner Program, and massage industry experts. With the growing interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Today's expert is Portia Resnick, who is an assistant professor at California State University, a board-certified massage therapist, and an athletic trainer with 25 plus years of sports medicine experience. She has her PhD in education concentrating on kinesiology. For 25 years, Biotone has been a supporter of the Massage Therapy Foundation, which provides grants, free education, and research resources to the entire massage profession. You can learn more about that on the massagetherapyfoundation.org. Well, let's listen and learn as Portia shares insights that sports massage isn't a specific technique, but is the concept of applying massage to active clients. Research on massage and sports massage is readily available to therapists. Understanding how to apply the current research to skills you already possess can transform or specialize your practice while benefiting your active clients. And hello, Portia. Thank you for joining us tonight.
Well, thank you so much for having me. And thank you so much for continuing to be a sponsor and a supporter of the Massage Therapy Foundation and a supporter of research and talks like this so we can bring some research forward. So I am going to do the thing where you cannot talk and share your screen at the same time. There we go. So here is my presentation talking about current trends in sports massage research. And if you know me, it doesn't really take very much to get me to talk about sports massage, whether I'm working with massage therapists or athletic trainers. This is one of my favorite things. So I'm glad to be able to bring this forward. I thank Biotone again, and I thank the Massage Therapy Foundation for helping us through this. All right. Oh, there we go. So what is sports massage? And it's massage performed directly in conjunction with athletic performance and fitness goals. And that's kind of the phrase that I use all the time, but I decided to kind of go through and look at some of the research and see what some of the other experts kind of had to say. So from a couple of my sources, sports massage is mechanical manipulation of soft tissue with the intent of helping recover from training and prepare for the next activity. And I definitely like that whole concept of recovery starts after your training session. And recovery goes until the next time somebody will go out and train. And then this last definition, manual manipulation of muscles and soft tissue by a qualified professional with the purpose of improving performance or recovery from sport. And I'm going to kind of contradict those authors a little bit because while the purpose may be for improving performance, that's not something that we're going to look at directly, but I'll let the research tell us that in a few minutes. If you have been with us with the foundation before, you have seen this pyramid. This is our research pyramid. It starts at the bottom with anecdotal findings, opinions, and those are expert opinions and ideas. So you, as the practicing therapist, as the instructor, as the student, you are right at that base of the pyramid. You have your idea as to what you think is important, as to what you want to find out. And sometimes we test those theories and we become our own researchers. As we move up the chain, we have case reports and case series. The type of research that I like to do is more in that observational studies, what some of my research nerds will call quasi-experimental research, because we're researching out in that real world. We're researching what people are doing. That's that particular type of research. When we get up that pyramid, we see the clinical trials, the randomized control. And one of the problems with randomized control is they're not very friendly to those of us who do evidence-based practice, because they're very, very stringent. And so many people will say, oh, the research doesn't match what I do in the clinic because I'm not taking into account patient or client goals. And you're absolutely right. That is the gold standard for research, but not the gold standard for clinical trials. But for today, we're going to actually spend lots of time at the top of the pyramid. We're going to look at those systematic reviews and those meta-analyses that are right up at the top. And the reason is because these research articles give us more bang for our research buck. These are, if it's a systematic review, it's summarizing all of the evidence on a topic. So there are multiple randomized controlled trials or case studies or case series or cohort type research, and we're gathering all of the evidence together to create a larger research project that's going to talk about the results and kind of summarize everything together. The difference between that and a meta-analysis, the meta-analysis is using statistics. So we're combining the results in order to get a greater application. So we could have, and typically with massage, you'll hear we have a very small effect size for massage. Okay, so how much massage actually helps from a statistical standpoint is really, really small. But the more people we add to that, the more power we have from that statistical perspective. So with a meta-analysis, we're taking multiple studies and we're putting the results together to gain better statistical results for us. So why do we like these? It really is helping us with that evidence-informed practice. If I read a randomized controlled trial that looks at women from age 25 to 35 and a particular technique for a particular condition, that study can really only reach that group. And kind of, again, from a research perspective, a lot of studies are done in ages 18 to 25 because a lot of researchers are on college campus and we use a population of convenience. I'm just working through a paper from one of my students, and that's the big thing is we're using a population of convenience. So the age range and the activity range is fairly close to that of college students, but that's not necessarily the person who's on your table. When we put everything together, we can garner really more significance. We can make it more applicable to your practice. And again, we get more bang for the buck. In order to prepare for this, I went back through some good standby articles, but then I found there's two really good new articles that are systematic. One's a systematic review and one's a meta-analysis from 2022, 2023. And those are a good part of what I'm presenting here today. Again, if you've heard me talk on this subject before, these are brand new. This is brand new information to my talk, and in some cases is kind of disputing some of the things that the previous researchers have found. Okay. So when we talk about the research basics, some things that we have to consider, again, in what we're looking at when we read the research article, and reading it with that critical eye towards being a clinician, right? A researching clinician, we've got to read it with that critical eye. So many studies focus on performance outcomes. And I know it's coming up on one of my next slides, but the reality is massage does not help improve those performance outcomes. There's very little to support that, but that's just a really easy outcome to measure, and it's something that people are interested in. One of the other things to consider is that a treatment may be done pre-event. That's not a pre-event treatment. There's a great study out there on mechanical manipulation pre-event. And when I read the actual protocol that they're doing, I'm like, wow, that's a great post-event protocol. The protocol was not developed by a massage therapist. It's not what I would do pre-event, but it's a really good protocol. So that article is great for the protocol, but not for the way in which they're using it. We also need to understand that when we look at our outcome measures, when we look at our results, it's aggregate among the group. So one person may be an outlier. They may have a really, really big change or a really, really small change, but we're looking at the mean. So we're looking at how everybody does within the group. And that may not translate to an individual person. One person may do great, but that may be dwarfed by the person who doesn't do quite as well within that outcome measure. But when we're thinking about our clients, that minimal change, that may very well be good enough for them. So again, we have to really keep a lot of that into consideration. So as I said, when we talk about performance outcomes, massage does not make us run faster or jump higher. It's really hard to get performance improvements. But I've done a lot of research on different modalities, and we get the same response, especially when I was an early researcher. There was a lot of research out there on kinesiotape, and I have some studies that I've done, some published and some published as abstracts and some as full articles. And kinesiotape doesn't show really great improvements in performance either. What we found in one of our articles is that it does reduce pain, and that's a good thing, but not necessarily improve performance. So whenever we're trying to look at that, and if a patient comes to you and they say, hey, can I come get a massage so that I can do better in my race or my activity, that's not guaranteed, but there's some other things that we can do that really can help influence that performance, or maybe that improvement is really, really just enough for them. So performance isn't improved. Why? The statistics don't add up. Again, that really small effect size. Again, having a small number of participants. And one of the things too is that protocols can't be varied in research. We have to do the same protocol over and over and over again. And that might not be the protocol you would choose if you could use a protocol for an individual client. We lose that ability to be a clinician if we are just looking at the research. Okay? Research has got to be stringent. So as an informed clinician, we read that research, and what we really have to do is combine multiple research studies and multiple areas of thought and our own knowledge of anatomy and physiology to really create that treatment plan. So the impact may not be direct, but that doesn't mean it's not helping, because I'm sure there's somebody going, I know massage is good for the people on my table. I have proof. I've got that anecdotal evidence. I do too. Okay? But I'm not here to report on anecdotal evidence as much as I'm here to report on the research. So what does the research say? And this is from some previous larger studies that are out there, systematic reviews. Objectively, it increases range of motion. That's really one of the biggest areas where we can see that improvement. Looking at range of motion, whether it's active or passive. It reduces the effect of DOMS, delayed onset muscle soreness, and I'll go into a little bit more detail on that in a bit. Subjectively, the feeling of recovery, and there's the part where somebody's going, yes, I know it works because my client tells me that it works. Absolutely. And subjectively, they may feel like they've got some reduced fatigue, which, again, if we think about massage and using it to recover from one activity and set them forward to the next activity, absolutely, that reduction of feeling fatigued is going to be a big benefit to them. This is one of my favorite long-term effects. There's no conclusive results that massage lasts over a long period of time. That means they have to come back. That's a good thing, right? It's not one and done with massage. And I'm sure there's a lot of you that are absolutely agreeing with me on that one. It is not one and done. We need to keep them coming back. There's no conclusive results that the effects are cumulative. So that's conclusive results. That's not an individual result. I do believe that we can make some changes, but again, research doesn't necessarily support that. Okay? And then again, because of those protocol differences, we can't compare study to study. And that's okay, because we can have great results with one particular person and not so great results with another. Okay? So some of the newer research that's coming through talks about, and I like the way this particular article broke things down. It talked to me about massage, for example, on motor abilities. It does not have a negative effect on force, and I love how that is established. We may see positive results, we may see no change, but it won't make somebody's performance or their force in this particular case go down. So the effect of the force, it's not so much a strength thing in this case, but it's the amount of force that the muscle can exert. So we're talking about how that's measured. So it does not have a negative effect. That's a good thing. And again, it may lead to better results following a fatigue protocol. So if we put someone in an intervention where we're causing muscle fatigue, and then we do massage, and then we retest them again, we're probably going to see better results with massage. And that's a good thing. Again, not all general training is going to cause that fatigue to happen. And that's one of the areas where research and real life don't necessarily intersect. One of my favorite things to talk about with my exercise physiology students is that a lot of research protocols will use a Wingate test, and a Wingate is a really hard anaerobic test, and they don't see improved performance in the next anaerobic test. Nobody likes to do back-to-back Wingates, and that's not a realistic response that somebody would do as part of training. So thinking about that a little bit when we're translating that research. But we may see some better results with massage following some sort of a fatigue protocol. And here's again this issue that I have with the protocols, especially if they're not coming from massage therapists, that some of those pre-activity protocols induce that parasympathetic response. In order to engage in exercise, we need to have some level of parasympathetic withdrawal and increase in sympathetic activity. That's just how the body responds to exercise. So we don't want that parasympathetic response in a pre-event protocol. Again, a lot of us don't use massage directly before an event. We may be more likely to see somebody later on. So that's where, again, I kind of take these results a little bit for what they're worth. Okay? With sprinting, neither reaction time nor event time really do we have much of an influence, so that's okay. And again, with our endurance events, and when I was practicing a lot more, most of my clients were marathon runners and triathletes. And so that active recovery, as somebody's coming down from that endurance event, massage works really, really well in that realm. Again, when we talk about range of motion, we get that significant improvement in range of motion, and massage and flexibility work really well. Some of the criticisms of those studies, again, we see some influence from outliers, and they don't always compare it directly to another intervention. So massage may be a good intervention. If we talk about something like foam rolling, which is also a myofascial release, that may also work. Stretching may also work as an intervention. So we can't say that massage is better, but we can say it works. And that's a good enough reason, I think, to get somebody on my table. when we look at massage and we look at the neurophysiological mechanisms, so how massage is affecting the nerves and then the actual physiology of what's going on within the body. And this was at a great conversation the other day with one of our exercise physiology professors, because he started asking me about some massage modalities. He's like, okay, but Portia, do they really work, or how do they really work? And I said, okay, I'm going to explain to you the physiology. And as soon as I brought that into physiological terms with him and actually used some of what you'll see on these next couple slides, he was like, oh, well, that makes perfect sense. And I was able to speak his language and to teach him why we do some of the things that we do. And I always say when I'm teaching physiology to students, especially, you've got to understand correct functions so you understand the body in dysfunction. And this is one of those areas. So we see a real positive trend between massage and the reduction of delayed onset muscle soreness. And here's the one area that I was talking about with my colleague. Our pain receptors, okay? When our fascia especially is really, really tightened down on our muscles, we'll get some of that mechanical pain. That's going to cause some chemical pain. As soon as we kind of release that fascia and as soon as we kind of open things up a little bit, our pain receptors start to shut down. Positive influence of that work of massage for that delayed onset muscle soreness. Delayed onset muscle soreness has a positive influence on the reduction of creatine kinase levels. It's the CK levels that cause DOMS. You'll see later down on the slide that it does not have an effect on blood lactate clearance. Blood lactate clearance happens almost immediately. Okay. And that buffering of the lactic acid, the addition of the hydrogen ions, there's a lot of physiology in there. That happens fairly quickly within that first hour. So we're not going to actually see lactate levels influencing delayed onset muscle soreness. Sometimes it's still taught that way. It's not going to matter. So if we're using that as a measure, we're not going to see those positive results. So if you're reading articles and you're like, but I thought lactate, or if your client, your patient comes in and they say, oh, I want you to get rid of lactate. Nope. Lactate's gonna clear on its own. We don't need massage to really do that. Now, where does it come into play? If we have somebody who has back-to-back events, and I always think about my swimmers or some of my decathletes, my track athletes that have multiple events, or if somebody is a weekend warrior and they're playing multiple rounds of golf over the course of a weekend or playing in a basketball tournament, if they have to perform before they can recover, they're going to really get some good benefits. And again, that reduction of DOMS works really well with that active recovery as well as massage. So I may throw in some more active types of techniques. I may have them move with me through the range of motion in order to really help influence that recovery. So why DOMS? Why am I focusing so much time on it? And not just because we're getting good positive results, but because I really think that this is something that's important that you can really take back to your tables to really understand. And one of the things with DOMS is to help influence that parasympathetic activity. We're neither sympathetic nor parasympathetic. Sometimes when people talk about it, it's like, oh, we're sympathetic or we're parasympathetic. It's one or the other. We're always within that autonomic balance. And if we can reduce that sympathetic activity, or if we can engage more parasympathetic activity, that's going to really help us to recover. That's a really big part of recovery. If you are one of those people who tracks different performance measures, if you've heard of heart rate variability, that HRV is a non-invasive way of looking at that modulation between the sympathetic and parasympathetic. We have to modulate between there at all times, but if we've got too much sympathetic activity over a day or a week or a course of time, that's going to delay that recovery. So DOMS is good at encouraging that body to recover. It can increase blood and lymph flow to clear biomarkers. Maybe not on an individual muscle level, because if you looked at that previous slide, I had some things that maybe it does or maybe it doesn't. That's one of those things that different studies are looking at different protocols and we're finding out different things. And again, fascia likes movement, fascia likes hydration. So even if it isn't blood flow, maybe we're just getting some of that lymph and it just clearing some of those biomarkers, for example, even that creatine kinase. And here's my big one. If we think it works, it's going to work. That psychosocial response that we think it's working. If the person on our table doesn't think that the massage is helping them, it's never going to help them. But if we can help bring them into that positive mindset, it definitely will come forward. And some of the things is the timing as to when we are working within DOMS. Now, delayed onset muscle soreness is going to peak between 24 to 48 hours post. So prior to that 24-hour mark, we're not really going to influence that delayed onset muscle soreness. So in other words, we really can't use massage to prevent that from happening. Again, this is the research talking. But if we wait 48 hours to 72 hours, we can really help with that clearance as our body is really starting to recover from that exercise. Here we're going back to that psychological mechanism, going back to that psychosocial response. Massage can help decrease things like depression, stress, anxiety, and the perception of fatigue. These are all things that we probably know and use for our non-sports massage clients. It applies to our sports massage clients as well. And whenever I talk about sports massage, especially for those who are like, is really what I do sports massage? Therapeutic and sports massage to me really kind of go hand in hand. And that therapeutic realm of the massage to help somebody feel better, to increase their mood, to increase that perception of recovery. So in an earlier slide, I said that massage, we're seeing it have good results on fatigue protocols. Okay, so one of those earlier studies found that even if it's not that physiological change, we're seeing that change in their perception, in their mood, in how they feel. Okay, and if they feel good, hopefully they're going to go out and they're going to perform better. So we might not see those big giant jumps in performance because we can't get them to jump higher or run faster, but maybe we can help them feel better during that performance, and that can really help. And the other thing I want to always bring out as a remembrance is with effect size, the difference between a first place medal and a bronze medal in the Olympics is not statistically significant. So whether we're looking at time or scores. So that level between being on the podium at the top and being off is really small. We can't expect to have big giant effect size and big giant jumps in our everyday clients. It's just adjusting what our expectations are. Okay. So again, how are we translating this into our practice? Consider what's being done. Standard protocol. I do not have a standard protocol for massage. I have muscles that I'll work in a particular situation. I have techniques that I like, but it's not cookie cutter. It shouldn't be standard. So when we translate what was done in the research to practicality, we have to use our clinical expertise. We have to let that guide us. Most massage is just done over one session. It's not always done in conjunction with performance. And that's something that I would love to be able to bring that research into examining somebody over the course of a season, because I think we'd get better results if we looked over the course of a season or over the course of a training cycle. Consider that the population that we're using is not necessarily the population which is involved in the study. Studies use population of convenience. Most of my clients, when I was practicing clinically, were 10 to 15 years older than the oldest person in most of the research studies that I do because of that population of convenience. I work at a university. I use my college students. Consider your practice, your patient goals, their stressors. Most of us may not be working on elite athletes. So what are their everyday life stressors that are contributing? What are, if they're training, those training stressors? And I always like to remind massage therapists that there is such a thing as a training cycle that we go through. And so we have to kind of speak from that level as to where they are. If they're training is getting harder, that recovery is going to be less. That's part of that super compensatory effect. Trust their training coaches that it's going to be hard in order to gain those benefits. How do we apply this to our clinical practice? Always know the limitations of the study. Okay. And every study has a limitation section at the bottom. But I think if you're a good, strong consumer of research, you can apply some of those on your own. Understand that performance isn't the only thing. It's easily measured for research purposes. It looks pretty on paper, but it's not the only thing. You're the clinician. You have a level of expertise. Know your anatomy, your physiology, know what you can do and how you can help them, and know what the research says. Always present the evidence objectively. Don't tell even if somebody says, is this going to make me perform better? Don't say yes when there really isn't the research to back that up, but explain the reasons why it can have that positive effect, because we do want people coming down. And feel free to share the part about it not really having a cumulative effect, and they need to come back for some more sessions. And then the last thing, never forget to look at some other modalities when you're looking at the research, because there's a lot of other things that we can use for comparison. When you're doing that research search, look for other things that we can share some ideas and some ideology from. Foam rolling, instrument assisted, some of the myofascial decompression or cupping. Even if those aren't techniques that you do or you use, a lot of the theories are the same. Whenever I hear people talk about not understanding what dry needling does, right? There's a lot of physical therapists that will use dry needling. I can explain what it does because I understand trigger points, so I can explain it from that different realm. Take what we know from everything else, but most of all, don't forget your basics. Go back to home base. Back to what you're good at, and continue to learn and educate for yourself. I'm going to end the show and take some questions from whatever we have. My slides should be available to you as well, so that you can see my references, which are on that last slide.
Well, very informative, and I don't know what dry needling is. So I wanted to ask you about that.
Oh, sure. So dry needling it's similar to acupuncture, using really, really small needles. And I'm not an expert on it, I haven't taken it, but they'll use little needles in different patterns. And one of the things I found as I watched other people do it is they follow a lot of trigger point patterns, and they'll get that little increase in blood flow on the really small microscopic level. And I'm like, oh yeah, I understand that. That's that same theory with trigger points. So that's my really real basic, because I I have not actually have not taken that course yet, but it's on my to-do list one of these days so I can learn more, so I can present more on it and help people understand it better.
All right. Sandy Fritz is asking a question, impressions about massage therapists, including stretching, and what approach?
Oh, there's a great question. Oh, thank you, Sandy. I love using my my PNF type stretching. I like my reciprocal inhibition or my post isometric relaxation because it really engages the tissue if I'm going to initiate any stretching. If I'm doing pre-event, I try not to do a lot of stretching because I don't want to influence their range of motion too much because that can affect their performance later on. The example I always use, if they're a hurdler and I give them too much range of motion, they're going to hit some hurdles. I can affect that a little bit too much, but especially in that recovery for that DOMS, I like to use a contract relax type of technique because I feel like it really engages again that neuromuscular response. Much to my clients' dismay, I don't like a lot of passive movement with that. They're not there to be stretched by me. So thank you for that, Sandy.
Well, still time to ask Portia questions. Feel free to chat them in. And, some people, and I'm going back to the introduction, where it's not a specific, sports massage is not a specific technique. And yet there are people that specialize in sports massage.
Absolutely, and I'm one of them. But for me, it's knowing and understanding how the body moves in sport. That's what makes it sports massage. Applying those techniques to an active individual, but it's not one technique. Swedish massage is going to increase that parasympathetic modulation. And so that's a great sports massage technique if that's what I'm trying to do. And that's what I'm trying to influence. And I feel like none of us should be like, I only do this one technique. It's really how you incorporate everything that you know into that particular person.
All right. And I'm thinking of cupping.
Myofascial decompression is the way I like to call it. But yes, absolutely.
Okay. Let's see. Best advice is to really think about what you are doing.
Yeah,
Came from
exactly.
Cynthia.
Yes.
And then, I'm going to ask a question before I get to Sandy's. Is there a difference between pre-active, let's say, sports efforts and post? I mean,
Yes.
how would that differ?
So when I'm doing pre-event, I want to engage that sympathetic activity. So I'm doing really quicker strokes. I might move them around a little bit more. I don't want them to get too comfortable. Whenever I'm talking to my athletic trainer friends, I'll be like, why are you doing pre-practice? You're throwing a heat pack on them, and then you're putting some oil or some cream on them, and you're relaxing them, and then you're sending them to practice, and they're all sluggish. So it's a lot of quick technique and a lot of movement in order to really engage their systems a little bit more. So that's going to be different. And then post is going to depend whether it's immediate, like right after, or if it's in that 24, 48, 72 hours after an event. Especially if I'm working with an endurance athlete, I like to see them a couple days later because I want them to get their metabolic stores back up. I want them to be able to fuel and hydrate before I see them a little bit more.
Okay. Let's see. Sandy is asking, biggest mistakes do you think are made? Also, relationship to other sports professionals and trainers.
know your lane, and know which ones you're in at the time, and cross them. As somebody who wears two hats, I know when I'm being a massage therapist and I know when I'm being an athletic trainer, and I can separate the two. Know that you have good strength and conditioning coaches that you can go to. You know, my colleague that I was talking about, he was asking me questions on massage. He's a personal trainer on the side. If I want to know a program, I'm going to ask him. I'm not going to create a program for somebody to train. So know what that is. Know what the roles of everybody else is, and really be part of that healthcare team. We need more of that interprofessional work. We need to, and we need to learn from them.
Absolutely. That's great advice. I don't see any other questions have come in. There's still a minute or two left. And I'm also not sure if any of our audience attended AMTA in Phoenix, but Portia was a presenter a couple of weeks ago at the AMT National Convention. Now,
Yes.
as I'm waiting for any other questions to come in, I'd like to mention that the Massage Therapy Foundation has actually been a great partner for EduTalks over the last couple of years. And many of their educators have presented EduTalks, and you can find those 3 years of EduTalks on biotone.com under the EduTalk tab. So be sure to check the archive library. And tomorrow, please check your, I call it an in basket, but in basket or inbox for a follow-up email with today's recording link, a copy of Portia's PowerPoint, and contact information for questions, as well as additional information on the Massage Therapy Foundation, which you can even get started on that tonight at massagetherapyfoundation.org. Let's see, I saw something else come in. Thank you for the webinar. I feel better about how I explain sports massage to clients. I work for a franchise, and sports massage is an upgrade with no real explanation. No questions, but big thanks and lots of info I can use.
That is the most important part, that I gave you some info that you can use. That makes me very, very happy. I'll also put a plug. I have a webinar from a few years ago on sports massage that's on the Massage Therapy Foundation webpage, and continuing education units come from that on behalf of MTF. So it'll go back to, you'll see some repeat because I use some of those slides, but this is the newer information, but feel free to listen to that as well.
Well, thank you for sharing it with us tonight. Thank you, everyone, for attending. Join us. And let's see, September 19th, the new EduTalk Diabetes series, and many of you have clients with special needs, is presenter Nathan Lesh. And the topic is Protect Your Feet, Prevent Diabetes-Related Amputations with Effective Foot Care. So something to consider for your diabetic clients. Also, September 26th, this month is flying, Kathleen Leeson will present Stress Reduction for the Lymphatic System. And taking a peek into October, October 10th, we'll have Benifer Bugli, and she will present on craniosacral therapy for sensory processing disorders. We have a great lineup now through the end of the year. Please join us again. Watch your inbox for follow-up email tomorrow. And again, as Portia said, she has more information on the Massage Therapy Foundation.org website. Thank you, everyone, and be safe. We'll see you again soon. Take care.
Bye.
Bye.